everyone, my name is Jasmine and I will be going over a movement analysis on drinking water from a glass. So the purpose of drinking water is that it is essential for survival and staying hydrated. It can also regulate body temperature, keep joints lubricated, and prevent infections. Drinking water can also improve cognition, mood, and sleep patterns. It can also do this by delivering nutrients to our cells. So before we go into the movement analysis, I want to make sure that it is known that we will be drinking water from a glass rather than drinking from a mug or a plastic cup. This will require the client to have strength to lift the glass and have the ability to grip and hold the glass throughout the motion. And now we will have a little demonstration. So today I'm going to demonstrate how to drink water from a glass. And now we will go into the action steps. So during phase 1, this is when the client is reaching for the glass. So the client will be seated at a table with the elbow in a flexed position and the wrist in a neutral position. The shoulder will be in slight flexion, and the elbow will then extend to reach the glass on the table, creating more shoulder flexion of the reaching arm. And this seated position will be maintained throughout the movement. So this chart shows all of the agonists and synergists and antagonists of the muscles in this phase. And as you can see, shoulder flexion will be about 90 degrees, elbow extension will be about 10 degrees, and these will both be concentric contractions. And the trunk will have extension of 0 degrees just to keep posture upright. And this is going to be an isometric contraction. And throughout the 4 phases, the first 4 phases, the wrist will remain in neutral position. So phase 2 includes grasping the glass cup. So the wrist will remain in neutral position with the shoulder flexed and elbow extended. The fingers will grasp the glass using cylindrical grip. This shows wrist, finger, and thumb flexion. And these are the muscles involved in this phase. And there's going to be wrist flexion of about 60 degrees, MCP flexion of about 45 degrees, PIP flexion of about 80 degrees, and DIP flexion of 15 degrees. Thumb MCP flexion will be 40 degrees, and thumb IP flexion will be about 30 degrees. And all the muscles in this phase are going to be concentric contractions, and the shoulder and wrist positions will remain the same as in phase 1. So going on to phase 3, this is when the glass will be lifted. So during this phase, the client will lift the glass from the table and bring the glass toward the mouth. This requires elbow flexion with slight flexion and abduction at the shoulder. The wrist, fingers, and thumb will maintain a flexed position in cylindrical grip. And again, this is the chart that shows the agonists and synergists and antagonists of the muscles in this phase. So going over shoulder abduction, there's going to be about 60 degrees. And this, with shoulder abduction, the scapula will also move in an upward rotation of about 20 degrees. And then elbow flexion will be about 115 degrees. And with these muscle movements, there's going to be a concentric contraction. And going to phase 4, this is when the glass will tilt. And when the cup reaches the mouth, there's a slight radial deviation of the wrist and pronation of the forearm when tilting the cup. This is where the client can drink water from the glass using some cervical extension and TMJ depression. So cervical extension is just when your neck slightly bends backward in order to drink the liquid. And TMJ depression is when the jaw slowly opens in order to open the mouth to drink water. And this is the chart, and we will go over wrist radial deviation. So there will be about 15 degrees, and forearm pronation will be about 20 degrees. And again, there will be slight cervical extension and TMJ depression in this movement. And lastly, the fifth phase is the lowering of the glass back to the table. So the wrist will come back to neutral position as the glass leaves the mouth and lowers down. This action also shows elbow extension and slight ulnar deviation as the glass sets on the table. The shoulder returns to starting position by way of extension and adduction. However, the shoulder and elbow may still have slight flexion once resting back on the table. So going into wrist ulnar deviation, there will be about 10 degrees. And for elbow and shoulder, elbow extension and shoulder adduction, there will also be 10 degrees. And shoulder extension will be about 40 degrees. And all these movements will have an eccentric contraction. So going into adaptations for a stroke. So stroke impairments include hemiparesis, which is weakness of one side of the body. And this can include difficulty producing movement and coordinating the arms, hands, and fingers, sensory and proprioceptive deficits. Weakness of the hand and upper extremity can also impair the ability to grip. And patients who have experienced a stroke may also show spasticity or contractures in the hand and upper limb. So some adaptations that can be used are mugs, and this can be a great way to stabilize the grip when drinking out of a cup. Rather than using a slick glass, a mug has built-in handles that can provide support without needing to fully grip the cup. This allows a client to not rely on their grip strength in order to hold something. And placing lids on cups or mugs can also prevent spills and injury. Going into the second adaptation is removable handles. So it has the same benefits as a mug, but this can also be transportable. So having transportable handles means that it can be easily carried and used for different types of cups. This is especially important when handles aren't available and you're looking for something to hold on to when you can't. It will provide stability of the hand and decrease the risk of spilling or dropping the cup. And again, these are different types of handles that can be removed. And these can show preferred grips and comforts, and the open-ended handles can provide easier placement of the hand. And the picture in the corner, the bottom corner, shows that you can use a dual grasp in case you need more stability. And the last adaptation is using long straws. So straws eliminate the need to reach and grasp the cup. These can also be beneficial for clients who have difficulty grasping due to contractures and spasticity in their hands and upper limbs. And these are my resources. And thank you guys for listening. I look forward to listening to all of your movement analysis. Thank you.